So let's understand about sudden SNHL. Okay, so what is sudden SNHL? Sudden SNHL, it's basically a condition where there is suddenly the person stops hearing. Suddenly the person suddenly the person he stops hearing. So what are the different conditions at which he stops hearing suddenly? Okay, so you can remember this by a mnemonic station. Okay, station. S refers to your syndromic. T is traumatic. E is autoimmune. Again, your T is toxic. Okay, I is infectious. Okay, this T is toxic as well as tumor. Okay, O is again autotoxic, and N is neoplastic. So there are various conditions by which you get sudden SNHL. So syndromic, what are the different syndromes associated? Usher syndrome, Alport syndrome. Okay, these are the different syndromes. There are Treacher's-Colley syndrome. These are the different syndromes associated with hearing. Okay, next, traumatic, because of certain traumas, slap injuries, or it can be a blast injuries, or more than 140 decibels of gun blast or shoot injuries that happens, and that leads to noise induced hearing loss. Okay, or fractures. Autoimmune means different autoimmune conditions like polyarteritis nodosa, rheumatoid arthritis. Okay, SLE. Okay, or EPLA. Okay, similarly tumor, certain tumor of the cerebropontine angle, acoustic neuroma. Okay, similarly infectious like measles, mumps, rubella, hepatitis. Okay, encephalitis, meningitis, encephalitis, Lyme disease. Ototoxic drugs, remember by the mnemonics AVCD. It's not APCD, this is AVCD. A is for analgesics like NSAIDs. Again A is for your aminoglycosides, very very important. SG is streptomycin and gentamicin, they are vestibulotoxic. Similarly KAN, that is K is similar to C, no? So cochleotoxic, it is amikacin and neomycin. V is for vancomycin, C is for cisplatin, D is for diuretics. There's a different drugs associated with sudden SNHL. Of course, neoplastic, as I already told you about the tumors. Plus certain conditions like the metabolic diseases like diabetes mellitus or hypertension can also cause sudden sensory neuron hearing loss. So what is the exact definition of sudden sensory neuron hearing loss? So write with me, more than 30 decibels of hearing loss, okay, in 3 consecutive frequencies, okay, for 3 days. So in less than 3 days you get this thing, SNHL, then this is known as sudden SNHL. Okay, so it should be treated on time. Treat it on time. So if it becomes irreversible, initially it is reversible, but later it can become irreversible. And irreversible hearing loss, it's very bad. Okay, so it's very simple to reverse it. It's very simple. And the overall drug, the almighty drug, steroids, are the mainstay of treatment of sudden SNHL. So you need to understand about the different investigations before I talk about treatment. So for the investigations, what you can go is you can do Rini's test. So of course we know that Rini's is going to be positive. It's going to be positive in sensory neuron hearing loss. But in case of severe sensory neuron hearing loss, there will be a false negative Rini's. So what is a false negative Rini's? That means bone conduction is more than air conduction. This is a negative Rini's, right? But it's a false negative. That means patient might actually show air bone conduction is more than air conduction, and when this happens we suspect that this is the case of conductive hearing loss. But in severe SNHL it might show that there is a bone conduction is more than air conduction. Why? Because this is 2 years, one ear is totally dead. If I perform Rene's in this test, totally dead ear, from the bone the vibration goes to the next cochlea, and this actually perceives it, and it feels like the bone conduction is more than air conduction, but it's actually of this ear. So this is a false negative, so please rule out this test. Okay, very good. Now next thing that you need to remember is, we already talked about this one. Now let's talk about PTA examination. You need to understand at what sensory, at what frequency there is particular hearing loss. Okay, and remember one very very important thing, that is, if there is certain SNHL and if you do not intervene in time, okay, it might be traumatic for the patient. The patient might actually lose hearing for life, right? So there is two theories that support this one. One is the viral theory. Second one is actually your vascular theory. So what does viral theory say and what does vascular theory say? Viral theory says that the sensory neuron hearing loss, it occurs from the apex and then it goes towards the base. So this is actually the viral theory. And if this happens, that means low frequency are actually affected first, and this gives a good prognosis. Okay, and vascular theory states that sudden ischemia, sudden trauma to the blood vessels leads to damage in the organ of Corti. And which are the most common cells being damaged in the organ of Corti? It is the outer hair cells, which is more sensitive. Okay, now you need to understand about the management of this case. So for management of this case, you will give steroids. So you will give high dose steroids, IV steroids, for about 10 to 14 days. So it should actually resolve within 2 weeks. So why should it resolve within 2 weeks? So if it doesn't resolve within 2 weeks, okay, if it does not resolve within 2 weeks, what is the outcome? What will be the outcome? The outcome will be, if it doesn't resolve within 2 weeks, the outcome will be it will have a poorer prognosis. So I want the treatment within a week. So within a week I want the steroids to work. Okay, so if it's a what will be the other supportive treatment? You can give antivirals. Of course, I told you certain measles, mumps, there are the viral conditions that you can give vasodilators. Why vasodilators? I already told you about the vasospasmic theory. Okay, vasospasmic theory, vascular theory. Because of vasospasm, there is the damage to the cochlea, right? You can give hyperbaric oxygen, or you can give carbogen inhalation. So what is carbogen? Carbogen means 95% of oxygen and 5% of carbon dioxide. So you can give this to the patient and the patient will recover. Okay, and if he doesn't recover, you need to plan for hearing aids. You repeat the PTA again, and you see the change, the difference after steroids and before steroids. What's the difference? Now if you need to plan for a hearing aid, you plan for a hearing aid and further evaluation is conducted. So sudden sensory neuron hearing loss, I told you about the causes by the mnemonics of station. I told you the definition, the causes, the etiology, the investigation, PTA repetition 2 times, and the management being steroids, of course, antivirals, vasodilators, carbogen inhalation. This completes the lecture on sudden SNH.